This case is about Margaret, who had recently come to counseling through a referral from her GP. The doctor simply diagnosed her with generalized anxiety, but I think it may not be an appropriate diagnosis. I'm gonna go through the case and find the best diagnosis and reflect on the etiology and prognosis. First of all, let's look at her symptoms. A year ago, she experienced the first panic attack while shopping. She began to feel anxious, nervous, and panicky. About 2 weeks later, the same thing happened. Ever since then, it's been a real effort to go out. A week ago, when she was doing the weekly shopping, she experienced panic again. Breathless, nauseous, pain in her chest, and she even thought it was a heart attack. She also thought that it was embarrassing because everybody looking at her and thinking that she was stupid. According to the information, we can assume that going out, such as shopping, is the trigger for the anxiety and panic to her. Agoraphobia is the Margaret's best diagnosis as considering these symptoms. This is classified with two ways. First one is accompanied by panic attack or panic disorder, and the other one is not. For this case, it is classified with the first one. Now, let's figure out how Margaret has developed the anxiety. This could be explained by two-factor model, fear of a fear theory, and other risk factors. In terms of two-factor model, the panic attack formed classically conditioned fear of shopping. After that, she started avoiding shopping as much as possible to reduce the fear, which means avoidant behavior is reinforced by the reduction in fear. This conditioning eventually led her often staying in. It is also explained by fear of fear theory. Agoraphobia is driven by negative thought about the consequences of experiencing anxiety in public. Margaret said when she was in the shop, she was embarrassed because she thought everybody was looking at her and thinking she was stupid. This is the evidence that she worries about the fear of experiencing anxiety in public. Let's take some risk factors in account as well. Her sensitive and emotional personality, a figure of woman, family history, abnormalities in the brain, major life stress such as stressful events and major life transitions could affect to develop the anxiety. To make a accurate diagnosis, we have to ask some further questions to rule out other similar diagnoses. We can ask some questions related to precipitating factors like what happened in your life a year ago when the problem first started, and also ask some questions related to predisposing factors like what are some significant events in your chart. Lastly, let's think about some effective treatment and prognosis. Agoraphobia is usually treated with cognitive therapy, behavior therapy, and medication. In terms of cognitive therapy, she can keep a thought recall for a week when her thoughts are negative and try to change the thought to positive way. Reading the self-help guide is helpful as well. She can also focus on breathing and positive self-talk whenever she felt anxious. Behavior therapy such as systematic desensitization can be used as well. It is graduated exposure therapy which helps effectively overcome phobias. She can practice this with the low levels such as simply imagining that she is going to shopping. When she manages the anxiety, she can move to the next level. The final level could be staying in the shop where the last occurrence happened. And when she can manage it, the anxiety going to the supermarket every day can play the important role to face the problem directly. Also, some medicines can be suggested for agoraphobia. The most common kinds are antidepressant and anti-anxiety medicines. It often starts with a low dose of one containing serotonin. I think the prognosis for Margaret is positive because she already broke herself the pattern of avoidance once and felt proud of her achievement. And according to the conversations, she seems keen to be active in the change process and is willing to carry out homework tasks. Thank you.